This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Hello there, everybody. My name is Wendy Jones, and I'm your host for the Next Steps for Seniors Conversations on Aging program. And I am really excited about our guest in the studio today. So each and every week, I do my best to really share information with you that will be helpful for the future you. And in my studio today is Dr. Fred Schimon, and we're talking about healthy teeth for life. And that is our topic. Why? Because we get one set and we need to take care of them. And as we age, I would say after the age of maybe 55, 60, you start thinking, oh, are my teeth going to make it? So today our topic with Dr. Fred is healthy teeth for life. So hello, doctor. How are you today?
Good morning, Wendy. I'm very happy to be here and nice seeing you again.
Thank you for being here.
Oh, yeah, thanks.
And how long have you been in dentistry? Tell us.
I graduated in 1984 from The Ohio State University, and I've been practicing dentistry ever since.
Just a couple few years.
Yeah, tremendously enjoy it, too.
Fantastic, fantastic. So as we age, really, our teeth start maybe not lasting as long, or maybe there's sensitivity, or maybe we have more cavities, or maybe they start decaying. I mean, all these things happen. Tell us what's the number one thing we can all be doing to prevent some of these things. And we're going to talk about all these in the future in this program. We're going to talk about gum disease, and we're going to talk about all that. But before we get there, what do we do to prevent all these different things? Because a lot of people have root canals and things that happen in their lives. There's got to be something specific.
Well, I would say, generally speaking, what's really important is all parents are concerned about taking their children to the dentist on a regular basis. That is critically important, the 6-month cleanings, because what's happening is you're monitoring continuously the state and condition of the teeth and gums. Really, the gum health is relatively automatically very healthy when we're young, but as we become older, we become a little bit medically compromised. The tissue, the gum tissue can break down, and also the teeth over time, they do become more brittle and susceptible to decay. But as long as you're getting your teeth cleaned every 6 months, it can be monitored so that severe decay does not break a tooth down so badly as that it needs to be removed.
And honestly, how many people, just out of curiosity, do you think go to the dentist every 6 months?
They really figure on the general population, perhaps 50% will visit the dentist on a regular basis. 50%, it could perhaps be even lower if you wanted to be specifically every 6 months. But they do say 50% of the people don't even go to the dentist.
Isn't it? I'm flabbergasted by that, because we get one set of eyes, one set of ears, and one set of teeth. And it's like, we need to take care of them.
Well, I feel like, just like anything in life, when you think about it, a lot of people don't have an appreciation for anything until they have difficulty or a problem with it.
Right.
So, as long as you're monitoring, you should be fine.
Right. So let's talk a little bit about some of the things that start happening with our teeth as we age. So one of those is gum disease.
Correct.
I think it's popular because for whatever reason, everybody I know has gum disease. And I'm in my 50s. It's okay. So what are the causes, and what does it look and feel like?
Well, most of the gum disease that we see, like we had mentioned before, there can be juvenile periodontitis, but generally speaking, children are not going to have it. As we become older, like we had said, the immune system becomes somewhat compromised and not quite as strong as it was when we were younger. The biggest thing is that a person can brush their teeth and floss, and they should be brushing twice a day and flossing at least once to keep all the food particles away from the interproximal areas, because the food particles feed the bacteria that live within the gum tissue itself, and then they release exogenous pigment or acids. And those exogenous acids that get released can break down the bone structure, and then you get the loosening of the tooth, and also it creates an inflammation of the gum tissue. So when a person begins to develop gingivitis or periodontal disease, what they'll do is they'll see that the gum tissues are becoming swollen, puffy, shiny, and also that they bleed very, very easily upon provocation, which means if you're brushing or flossing, you will notice that bleeding occurs. So at that point in time, many times, you'd have to see your dentist and get scaling and root planing done, and then have regular periodontal maintenance visits, which occur 3 times a year rather than just twice a year.
So more attention.
That's correct.
Absolutely.
Yep, just like anything, you have to pay a lot of attention, and maintenance is critically important for anything to last, have longevity.
Does brushing have anything to do with, I'm just curious, if brushing has anything to do with gum disease?
With brushing, what's really, really important is to watch it that when you're going on the sides of the teeth, you want to do small circles and sweep down toward the chewing surface of the teeth for the upper ones. And on the bottom teeth, we would do small circles and sweep up on the gum tissue. You're always trying to pull the gum tissue over the tooth. You do not vigorously want to take your toothbrush and push very hard and go fast on the sides, because it can cause recession and grooving of the outer surfaces of the teeth. Then that also would lead to more decay in that area, because you're losing the enamel of the teeth in that area and gum tissue.
Well, and what's so interesting is someone actually told me if you brush your teeth with your left, like if you're right-handed and you brush your teeth with your left hand, you actually do, you're not as rough on your mouth, right? You're not like circling and pulling your gums and all that kind of stuff. Is that true? Or
yeah, that's true. I mean, a person is obviously, more dominantly handed with one hand than the other, and naturally the tooth that's not so or the hand that's not so dominant will not probably push as hard. So the biggest thing is just always trying to pay attention that when we brush, not to brush too vigorously. It's more the number of times that we brush per day, the light application of the bristles stimulating the gum tissue to bring in a fresh flow of blood, which brings antibodies and antigens with it, to keep the gums and the teeth in a healthy state.
It's so important, brushing and flossing. And I just want to say, let's all make a commitment right now. Let's all floss once a day and brush twice. I mean, it doesn't seem that hard to do, right? Why do we struggle with this
Well, I mean,
so
that's
much?
an obvious thing that's a really great idea to do. And I'm saying even if you're at a seminar or at work and you cannot brush your teeth or floss, just rinse your mouth out with water. It's a good idea, just trying to get those food particles out, especially the ones that are trying to trap themselves in between the teeth.
So let's talk about what happens with that. Is that when cavities form?
Well, what happens with the foods that we eat, we're in a society that has many refined sugars in the food. And what happens is that sugar will stick to the teeth through what's called the plaque that forms. And what happens, that plaque, when it incorporates calculus into it, it becomes known as tartar or calculus. And that's when you go to the dentist and they utilize the instruments to vigorously clean off the sticky, tenacious tartar and calculus, because that's calcified plaque, and that's what actually creates the breakdown of the teeth. The beginning stages of plaque 2, which is basically the white, cheesy-looking formation that occurs on your teeth, that needs to be brushed regularly, and that's why you're trying to brush twice a day, is in order to get that off your teeth.
Right,
Yep.
right. And they're using, I know that this is a big hot topic, but it's probably a little older now, but the good old silver fillings, people are replacing those now with.
That's true. Generally using composite materials. I cannot remember the last time I used silver in my dental office. But the concern about the silver was the mercury that was in there, and then sometimes also for long term there could be release of some of the vapors from the mercury that could contribute to perhaps even Alzheimer's or other diseases. And that's why we use composite materials which bond to the tooth, where the amalgam material really never bonds to the tooth. You just have to cut retentive grooves when you put a silver filling in. So we're concerned about, mercury release, and that's why we're replacing those with composite.
Right, right. And just like anything, right, as we learn and we grow and we're figuring things out, we make changes. Do you recommend people who do have silver fillings to get those switched out?
Only if they realize that they're having some type of difficulty or problem with the silver fillings. Okay. Generally speaking, silver fillings have been here for many, many years, and the longevity of a silver filling is excellent. If a person really doesn't have recurrent decay around it, I'd recommend just holding on to that until it does break down, and when it does, then replace it with a composite restoration.
This is why we need you. See? There we go. So, Dr. Fred, share your phone number with our listeners, because if they do want to come to you for dentistry, you're here in the local area in Michigan.
Correct. Yeah, I'm located right here on the corner of Avon and Livernois Roads in Rochester Hills, Michigan. The address is 940 West Avon Road, Suite 6, Rochester Hills, Michigan, 48307. And the office number is 248-651 1940, and I also have a second location in Genesee, Michigan, and that's 7485 North Genesee Road, and the phone number there is 810-640-1970.
Awesome. So let's talk a little bit about, we've got a minute left in the program today, and I wanted to just ask in this segment here about dry mouth. It's a big topic for seniors. Okay,
so as we become a little bit older, especially mouth breathing could occur while we're sleeping. But also as we age, xerostomia, which is dry mouth, occurs. And with xerostomia, what happens is the saliva cannot carry its nutrients to the tooth structure, so therefore the teeth become more susceptible to decay. So perhaps even as an aging adult, what we could do is make sure that we're taking very, very good care of our teeth, brushing and flossing, and we could perhaps even do a fluoride rinse once in a while to help with that. Also, radiographic treatment or radiography when one has cancer, that also, as it passes through, if we have oral cancer, that can cause more decay on the teeth and breakdown of the gum structure. So that's something you'd like to be aware of. So I would say any type of rinses that you could do that would have fluoride in there would really help a lot. And paying attention to that, we'll regularly drink water and keep ourselves well hydrated.
Definitely need to rehydrate our mouths and avoid candy and sugary foods, obviously.
Well, if you do want to have candy and sugary foods, we know that has other health problems that can be created. So you'd really want to watch how much sugar you consume. But as long as you brush afterwards, you should be fine to enjoy a good piece of chocolate or cake or whatever else that may have a lot of sugar in it.
You're listening to Next Steps for Seniors, Conversations on Aging. God bless you.
This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Welcome to Next Steps for Seniors, Conversations on Aging. My name is Wendy Jones, and I'm your host today. And our topic today is healthy teeth for life. Actually, I should say gums and teeth for a lifetime. Because we're really talking about here with Dr. Fred Schimon, we're talking about your teeth and how to keep them as long as you possibly can. So we get one set of eyes, one set of ears, and one set of teeth. So our goal is really to take care of them. So flossing, brushing regularly. I mean, these are all keys to going to the dentist every 6 months, which, by the way, insurance covers. So let's try to do that. And in addition to that, a lot of things still might happen as we age. And that is why Dr. Fred Schimon is with us today to tell us and share information. But before we get into that, because we are going to talk about dentures, we are going to talk about, some of these other things that happen as we age, root canals, that type of thing. But before we get there, a lot of people have questions about insurance. So I just want to share with you, Medicare Advantage does have a dental plan that goes with it if you're a Medicare Advantage, which I think about 50% of the people usually have Medicare Advantage. The other 50% have straight Medicare. Straight Medicare does not cover dental unless, you ready for it? I should say it doesn't generally cover dental, but there are some exceptions. If you need dental care because of an illness or injury that requires a hospital stay, your dental treatment may be covered. And an example of that would be like a fall or fracture from on your jaw. Medicare may pay for the surgery to rebuild the bones in your jaw and fix any damaged teeth. So that's the type of thing that would be covered under straight Medicare. But you can get a supplement if you have straight Medicare. So there's basically two plans, the Medicare Advantage, which does cover dental, and then the straight Medicare, but you need a supplement unless you have one of those things I just mentioned. So I know it's confusing, seniors, but I do recommend to talk with your Medicare specialist about dental, because as we age, these things cost money. And that's what Dr. Fred is going to talk to us about today, because the one thing that happens if you're not brushing and your teeth start decaying is you need to get what? A root canal, correct?
Correct.
All right. Yes. So talk to us about that.
Yeah, generally speaking, a person would like to go to the dentist twice a year to do regular checkups and cleanings, exam on the teeth. And as Wendy had mentioned, that the teeth do need to be kept clean, otherwise severe decay can break them down. So the person has the option that when they do have severe tooth decay, you can still retain the tooth by doing a root canal, putting in a post and core, and then crowning the tooth. And this will put long-time preservation of the tooth. Another thing that's a choice for a patient would be that if they feel that the root canal, the post and core, and the crown are too expensive to preserve the tooth could always be removed. But the less teeth that we have, then there's less support for a partial denture. Generally speaking, a person, if they don't take care of their teeth and they get severe periodontal disease and a lot of tooth decay, they could end up losing their teeth, and then they have to go with a complete denture. But if we maintain as many teeth as possible, we can put in a partial denture, and the partial denture gains stability through the few existing teeth that remain. And we would hope that it would be more than just a few, as long as you maintain the teeth by doing a root canal, post, core, and crown, and getting them cleaned regularly.
Okay, I'm going to stop you 1 second. Post
and core and a crown.
Okay, tell us what that is.
Oh, so after a person does a root canal on the tooth, because the teeth do become more brittle and susceptible to fracture and breakage as we get older, after you do a root canal, you've taken away the vitality of the tooth, making it even a little bit more susceptible to breakage. And that's why you would like to take a post and put that into a tooth. It's a little bit like the steel rods they put in cement when they're building roads, and makes the tooth stronger. So when you put a crown on it, the tooth does have greater strength and stability, giving you a longer life with that tooth. Generally, those are the choices. And as Wendy had mentioned, there is a cost in doing that. Naturally, that option is much more expensive than just removing the tooth. But God gave us all our teeth for a purpose, and the maintenance of them is critically important, and nothing works as good as the teeth that we were given. And also throughout life, we have our baby teeth that usually last till approximately age 6 or 8 years of age, and then our permanent teeth come in. So we are not like sharks and alligators called thecodonts where teeth get replaced. We have to maintain and keep what we have. And as Wendy mentioned also, we want to hold on to those the best that we possibly can. And it's up to you. Those are your teeth. You need to brush and floss at home. It's much more important what you do at home than what we can do in the dental office. The maintenance, proper maintenance of the teeth is good. If there's a high intake of sugars, brush shortly thereafter to keep the sugars off. And naturally, some people build up plaque and tartar a little quicker, so some people need to get their teeth cleaned every 4 months rather than every 6 months in order to hold on to their teeth and provide longevity. The other option that one has also, if a person doesn't like complete dentures, because the upper ones generally will fit well, but the bottom ones are called clickers. And the reason being that is because the lower jaw does resorb over time, and the tongue is down there constantly loosening up that lower complete denture, and it clicks with the upper one, and people become very, very frustrated. But the upper dentures do look nice, and they can be retained. So that's why it's trying to be explained to you at this time that we'd like to hold on to the teeth that you have, so when you have partial dentures, there's stability in the mouth by the teeth that you've retained. And the more that you can retain, the better. Another fact here is if you lose all your teeth by complete dentures, and there's frustration and there's shrinkage of the ridges, and then once those ridges resorb, and they will resorb over time, then the dentures will not fit as good, and you can go with dental implants, and you can have complete dentures that are placed over implants, or you can have crown and bridge work placed over those implants, which restore you back to a normal appearance and function. But once again, as Wendy had mentioned, there's a cost factor involved here. So the most basic way to go is to have your teeth cleaned and examined all the time, so you have minimal dental expenses. Then if you begin to lose a few teeth, you could always go with a partial denture. But
so I'm going to ask really quick. I'm sorry, I don't mean to interrupt.
Oh,
so
that's fine.
The partial denture is just the top and
no,
not
the
bottom? Or
no.
what exactly is partial?
Oh, yeah, partial denture can be for either arch. And what happens with that, it can be retained in the mouth by attaching to the neighboring teeth.
Okay, but you got to do the whole top or the whole bottom. You can't do half of the top with
You
partial.
could, with a partial denture, generally speaking, it does cover the entire arch on both sides because it has to have stability and retention.
Right. Okay, got it.
So sometimes, though, if a person has just 1 or 2 missing teeth in an arch, you could do a small partial denture that can be taken in and out. That's the disadvantage also, where implants, the teeth are in there indefinitely. But with a partial denture, you have to take that out when you go to bed at night, and you should brush just as a person takes their shoes off when they go to bed.
Well, and that's what's also, there's a lot of maintenance that comes with dentures. And as we age, we don't have as much, time, energy, all of that stuff. So it gets difficult. The mobility is limited, right?
Yeah, I would agree with that, the implant would be the way to go, but before that would be the root canal, post-core, and crown, where you can save that tooth so that you don't even need to get to a partial denture.
Right.
But partial dentures are tremendously better than complete dentures, so holding on to every tooth you can is critically important.
I like that, and thank you for sharing. It's probably half the price, too.
A partial denture and a complete denture, generally speaking, they are both about the same price. But what happens, partial denture can cover many teeth for the teeth that are removed, whereas if you do implants, each implant can be rather costly. So that's why you want to try to get as few implants as possible and keep the teeth that you have.
So I want to just share this because I'm passionate about it. I want to share with you that dentists are required to offer every option to a senior to allow them to make a decision. So they're just like Dr. Fred Schimon did with us. He gave you first do this, then this, then this. These are all your options. So I just want to encourage you, this range, keeps your teeth healthy, the partial and the full, but you want to do your research and you want to decide what is best for you based upon the information you receive from the dentist. So just keep that in mind. And if you want to do some research on your own and say, let me think about it, doctor, I'll get back with you on what I want to do. I don't want you to feel like you have to make a decision on the spot. And I say this because I had a personal experience where somebody said, hey, you need to do this, this, and this. Let us not forget we are in a world of everybody makes money off of procedures, but we want to be smart about it. These are our teeth. Right?
Correct.
So we want to be smart about it, but we also want to educate ourselves. And that's exactly why you're here today. So thank you for sharing this, doctor, because it's helping all of us, number one, be more motivated to take care of the teeth we have. And number two, to know that there is a partial available and to keep the other teeth there. Can you talk a little bit about, I think bad breath is a big topic as we age. What's your thoughts on that? Is there something we can be doing to eliminate that?
I would say bad breath, what contributes to bad breath many times is acute necrotizing or acute ulcerative necrotizing ulcerative. And what that is basically severe gum disease. And with the severe gum disease, it gives off a noxious odor, and that's why it's so critically important to keep your teeth brushed and flossed and examined regularly, because when you get this condition, the breath really does have an odor to it.
And chewing gum's probably not the best option.
Well, I mean, sugarless gum may be the best option, but keeping your teeth cleaned and examined and not allowing to decay to get real bad, because if the gum tissue begins to break down and you have severe decay, it does give off a noxious odor, and you definitely have to monitor that and take care of the teeth that you have.
Exactly. So our goal is to care for our teeth, keep them as long as we can. And let's not forget the number one reason we need them is to eat. We want to chew our food, we want to eat healthy foods, and we need our teeth to do that.
Plus aesthetics and a nice smile, too.
Of course.
You only have one chance to give a first impression.
Of course. All right. Well, God bless you. Thank you for listening to Next Steps for Seniors.